Okay, so anytime you want to go ahead.
All right. Hi, everybody. I'm Cassie Snyder. Thank you for joining us. We tried to go live a few minutes ago and we're having some technical difficulties, so maybe next time we'll be able to join you live. If you do have any questions, feel free to message either myself or Mercedes, and we will queue your questions for the next session. So as I said, I'm Cassie Snyder. I'm the Director of Events with Birth Unlimited. I just pulled up our description. Birth Unlimited is a nonprofit consumer organization supporting families seeking healthy alternatives so they can make the most informed choices during the childbearing year and beyond. And we also print Birthing Magazine 3 times a year, if you're unfamiliar with that. And with me today is Mercedes with Vida Health and Wellness, and I'll let you describe yourself.
Hi, I'm Mercedes Eustergerling. I'm a physiotherapist and an international board-certified lactation consultant. And I'm at Vida Health and Wellness, which is a women's health clinic in Calgary, Alberta, in Canada. And I personally provide pelvic health physiotherapy, breastfeeding support, infant feeding support. And we also have another physiotherapist who does as well pelvic health and breastfeeding support, just like I do. And we also have an occupational therapist. She really focuses on mental health, and she does pediatric pelvic health as well. And so we work together quite collaboratively as a team through the childbearing years and across the lifespan in women's lives to really help them get the most out of their lives and be able to do the things that they want to do.
Great. I'm just going to get right into the questions. I'll read them from a first person's point of view. So, I'm pregnant and hoping to be able to breastfeed. Are there any precautions that I should know about with COVID-19? Go ahead.
Yeah, so that's a really common question that I've been hearing these days. Excuse me. There are some reports, especially out of the States, where people have heard of childbearing parents having babies and then being separated from their babies in the hospital as a precaution against transmitting infection. The good news in Canada, at least, is that that doesn't seem to be the case at all in terms of what's happening. The World Health Organization says, yes, continue to breastfeed. There are some precautions that you can take to protect your baby as best as you can. But breastfeeding itself is protective against a lot of infections and pathogens. Breast milk and colostrum, which is that early milk, has a lot of components in it. Excuse me. A lot of components in it that can be protective and really good to build up your baby's immune system. So the World Health Organization still recognizes the value in breastfeeding, even in this situation. And the Society of Obstetricians and Gynecologists of Canada has guidelines as well, saying people who want to breastfeed should be allowed to do so, and that it should be a discussion between health providers and the families, and people who are wanting to breastfeed should be able to make that decision on an informed basis. So at the end of the day, yes, if you want to breastfeed, you still can. There's nothing that says that you can't breastfeed, even if you test positive for COVID-19. If you're in Canada, as far as I know, there's nothing that says that you can't. The things that are going to be recommended during this time as extra precautions are, of course, hand hygiene. So anytime you or anyone comes into contact with your baby, making sure that you're doing proper hand washing, that 20-second wash in between your fingers, back of hand, get your knuckles, get your nails, get your thumbs. There are lots of videos out there for how to do really good hand washing. And that doesn't just apply to breastfeeding, it also applies to bottle feeding. And then wear a mask if possible. So that's from the World Health Organization recommendations specifically. So if you have something that you can wear to prevent any droplets or anything from exchanging from one person to another, then they say wear a mask if possible, if it's available. And then they're also recommending that if you're pumping or bottle feeding, that you sterilize pump parts and bottles after every use. Sometimes outside of this situation, you can sterilize your pump parts, every 24 hours, or there are different recommendations. But right now they're saying just sterilize them after every use, recognizing that that's a lot more work. And pumping on its own is a lot of work, and bottle feeding on its own is a lot of work. So if you have somebody else at home who can be in charge of sterilization, and then you can be in charge of the feeding, that can be really helpful. But definitely there are some precautions, but overall, if you want to breastfeed, you can go ahead and breastfeed.
That's wonderful. Thank you. So our second question, if I have difficulties with breastfeeding and I don't want to leave the house, how do I get help? Where can I buy bottles or rent a pump?
Hey, yeah, so that's another question that I've been hearing a lot, different variations lately, because a lot of people don't want to leave the house because that's the safe thing to do right now. And that's what our governments and agencies policymakers have been telling us to do. And so it's really understandable that people are trying to minimize their trips to leaving the house. So there are some different options depending on the breastfeeding difficulties that you have. Probably the first step to take is to connect with some other local parents, breastfeeding support group, and ask questions of them. If you're looking for more like one-on-one support, or to reach out to a lactation consultant or a breastfeeding doctor, a lot of us have virtual visits available. I'm doing virtual appointments, telehealth kind of appointments like this, like through video. And I know that some of the lactation doctors in town are as well. And so you can still continue to get a lot of that support without having to leave your house, which is fantastic. And then if you do need to leave your house, like if your baby has a tongue tie that needs to get clipped, or something that just needs to be seen hands-on, I think it's important to remember that eating is essential. And I think that sometimes we forget that the grocery stores are open for a reason, and it's so that we humans can eat. The pet stores are open so that our animal companions can eat, and the breastfeeding clinics are open. So the lactation clinics that are run by the doctors are open, and that's because feeding is essential. And I think that sometimes we think that, breastfeeding is a nice to have and not a need to have, because we do have alternatives like formula and that kind of thing. But at the end of the day, if you can breastfeed with some support, it really is the best thing for both mom and baby, or parent and baby. And so breastfeeding is essential, infant feeding is essential, and getting that support is really, really important. So those clinics are still open. They're taking lots and lots of precautions to make sure that it's a safe place. You can call them and you can find out and ask questions. I would just really, really encourage people to continue to get support, because right now it can feel very isolating, which is, it's already hard enough when you're a parent and trying to figure out what to do with this baby. And so I really, really encourage people to reach out and ask for support. And if anybody is not able to help you in their normal capacity right now, they'll let you know, and then they can help you find somebody who can. In terms of buying bottles and renting a pump, pump rentals still available in a lot of pharmacies. So they're also taking extra precautions with sterilization and cleaning. But I've heard from lots of pharmacies that they are still renting out pumps. So just call ahead of time. And then with pumps and bottles, a lot of stores are doing curbside pickups, where you can call and make an order, give them your credit card information, and then come and pick up. Like, they'll bring it to you just outside the store. Like, you can come in your car and they'll bring it to you in your car, and that kind of thing, or you can send somebody else. So lots of people are accommodating the situation right now, and it still is possible to get those things that you need.
Great. Just for my own personal curiosity, I'm wondering if Le Leche leagues are going to the digital realm during this time. Do you know?
Yeah, a lot of them are. Yeah,
awesome.
Definitely, which is nice, because that makes them easier to get to.
Yeah, like, I mean, it was always hard anyway, but yeah.
There's a really good, I'm going to plug a really good Le Leche League group here in the deep south of Calgary, in Mackenzie Town. And I know lots of people who would love to be a part of that, and now they can, even if they're in other parts of Calgary. So yeah, they're doing virtual meetings.
Awesome.
Yeah.
All right, third question. Is it possible to pass the coronavirus on to my baby through breast milk?
So this is where I think some people are apprehensive to either breastfeed or to pump and feed their baby their own milk, or donor milk, or any of those kinds of things. There's a lot of unknowns right now. So I just want to be really quite clear and say that what we know about this virus is that it's probably transmitted through droplets. And so what that means is that somebody has to breathe it out, and it comes out when we breathe. There's water vapor and all kinds of things that come out with our breath. Those little droplets then can land on the surface, and that's how people might be able to pick it up from the surface. There's no indication that the coronavirus is transmitted through breast milk. We wouldn't expect it to, being a respiratory type of infection, but there have been studies, research studies, where people have looked at breast milk from people who have tested positive with coronavirus, and they have found no evidence of the virus in the milk. And so that's why the World Health Organization is feeling comfortable saying, yes, go ahead and breastfeed. That's why they recommend wearing the mask and washing your hands and taking those precautions, but there's no indication, as far as we know, of it being transmitted through the milk.
I see. I've heard that breastfeeding shouldn't hurt, but when I latch my baby on, I have nipple pain for the first 10 to 20 seconds. Should I see a lactation consultant, or will it get better over time?
So I think that there are a lot of shouldn'ts around infant feeding. It shouldn't hurt, it shouldn't be hard, it shouldn't this, that, and the other. And so anytime I hear somebody who's been told that something shouldn't around infant feeding, I want to start there and address the fact that your experience is your experience, and whether it's a shouldn't or a wouldn't or a couldn't, whatever those qualifiers are, it's your experience and it's valid. And the reality is that it is hurting, and that pain isn't pleasant for anybody, regardless of whether or not it should be painful. So just addressing that first, I think, is really important. So if you're watching and this is something you relate to, I really hope that you hear that you have pain and it's uncomfortable, and that's not fun. It's unpleasant. So one thing that a lot of people know is that sometimes breastfeeding is uncomfortable, especially those first couple of weeks. Your nipples are sensitive, the skin is maybe raw, your baby's still figuring out how to latch and how to suck, and you are too. You're trying to figure out how to latch. And so those early days, it can be uncomfortable. So I always let people know that, if it's toe curling pain for those first 10 to 20 seconds, if it's making you dread feeding your baby, like when your baby cries, your first thought is, oh no, because it's going to be painful. Or when you go to latch, you go and just kind of get ready. That's an indication that something's not right, and that it should get checked out. So definitely in those cases, go and see a lactation consultant, either virtually or in person, whatever is most appropriate for you in your situation. Will it get better over time? If it's like the first couple of weeks and it's tender, and you're having to apply, some lanolin or something, some nipple cream, and that's about it, but it doesn't really bother you, then it probably will get better over time. If it's that toe curling pain, that dreading the feeding pain, that I don't want to latch on kind of pain, that tends to not get better on its own. And so it's worth getting somebody to have a look at what's going on. And sometimes it can be a really simple thing, just tweak your positioning a little bit, get baby latched on nice and deep, and then it doesn't hurt anymore. And so it can be really simple, and I just don't want people to be afraid to reach out if that's the experience that they're having.
My baby is really hard to latch. She seems hungry, but when I try to feed her, she squirms and cries and her hands get in the way. She's 2 weeks old. What can I do?
Really, really common. So a lot of people will tell me that, they have difficulties with latching their baby. They go on YouTube or they go on Google and they look up, how to latch a newborn. And they see these videos of probably older babies, 2, 3 months old, who already know how to breastfeed. And they get told, you just, put your baby's nose in front of your nipple. They open their mouth and on they go. And that's how you latch a baby. And I keep waiting for somebody to make a video of how to latch a baby that's like an octopus, like hands everywhere, arms everywhere, and crying and hungry, and you're sleep deprived. Like, we need that video.
It's so true. Yeah.
So this is really, really common. And the reality is that it can be one of a couple of things, or one of a few things in general. Sometimes babies cry and they're not hungry. And so we try to latch them, and maybe they have, a belly full of air and they're crying because they need to burp or they need to pass gas. And they're like, I don't want more in there. My belly's already distended. And then we interpret that crying as more hunger. So just take a moment and think, okay, if my baby just ate, 20 minutes ago, got a full feed, but they're acting like they're just starving. And then I try to latch them and they don't want it. Just putting some of those pieces together. I know it might sound logical when I say it, but when you're sleep deprived, you don't necessarily think of that. You think my baby's desperately hungry and they want more. So always good to just kind of check in and think about our assumptions. Is my baby hungry? Is a 2-week-old? Probably yes. So if they're crying like that and they haven't recently fed, oftentimes they will be hungry. What a baby needs in order to latch comfortably is they need to feel like they are secure. So sometimes that looks, well, every time that looks different for every baby. So some babies, you can easily latch them on when they're crying because their mouth is open. You just take that opportunity and get them on. And getting them on is what it takes to get them to stop, crying and fussing, and that's what calms them down. Other babies, if they're already upset, they need to just kind of come skin to skin, head on your mama's chest or head on a parent's chest and get a little pat, get a little rocking, and then you can try again. So getting to know your baby and seeing if they can get on when they're upset or if they need to be calmed down first. Some babies, if you try to calm them down first, they get more upset because that's not what they want.
Right.
So trying different things and seeing what works for your baby. For the hands and for the squirming, oftentimes, again, that comes back to wanting to feel like they're secure. So the hands, sometimes babies will instinctively want to have them in front of them, and that gets in the way of feeding. And so helping them by putting one hand on either side of the breast and having them kind of hug the breast, because that way they can get in nice and close, tummy to tummy with parent, rather than having hands in between and then they're just too far away to be able to eat, to be able to feed. So putting hands on either side. If you swaddle, then that makes it really hard for baby to feel secure. They don't have a good hold, and then they might get more squirmy. It makes it a little harder to get a good latch with swaddling. And then with the squirming, I find oftentimes parents will actually be holding the back of baby's head, and so they'll be trying to latch. And if there's one thing that we were taught about handling a baby is, hold the head, support the head. And so we instinctively do that, and we hold our baby's head when we're latching, even if it's just at the bottom of the head. Babies really don't like their heads being touched when they're feeding. And so they will push back and they will resist if you touch their head. What you have to do is either use a pillow or use the crook of your elbow, or use gravity, lean back and have baby on top of you in order for their head to not flop around so that they're supported. So either elbow in that cradle position, use a breastfeeding pillow, or lean back or side lying so that their head is supported, but you don't have to touch it. And then your hand goes right between their shoulder blades and pushes them into you just kind of firmly so that they feel that security. And once they're close to you, belly to belly, ideally skin to skin, their hands are on either side. They're either settled or you can latch them when they're crying, depending on the baby's temperament. That should resolve a lot of the issues with those early days and the squirmy, agitated infant that I think many of us are familiar with. It doesn't solve all the issues, but those kind of tweaks do really help.
Yeah, what a great description. Makes perfect sense. Okay, the next question. My son is 4 months old and he is exclusively breastfed. He used to take the bottle a few months ago, but now he won't. I've tried so many bottles. I just want him to take one every once in a while so that my partner can feed him. Is there a trick to getting him to take the bottle, to like the bottle?
Yeah, I think oftentimes we spend so much time working on breastfeeding, and people who are able to get it exclusive breastfeeding then have a hard time sometimes because their child won't take a bottle. And so, you know, you go through all the brands, all the different types, same kind of thing with the soother. But oftentimes, yeah, they just want their partner to do a feeding every once in a while, get a break, or have, I mean, right now, not social outing, but normally, or maybe a Zoom date with some girlfriends or something like that. So this is fairly common that a baby won't take a bottle, and it's distressing for the mom sometimes because then she feels very tied, right? Almost tethered. It can provoke a lot of different feelings in people. So one trick is to forget the bottle and use something else instead. So little known fact is that, oh, we're getting, there we go, we're back on. So little known fact is that babies can actually cup feed from day one. And so they can feed from an open cup, which a lot of people don't know. We think, you know, they have to go bottle, sippy cup, open cup. But brand newborn babies can feed from a cup. You just use a tiny little cup. Actually, a shot glass works really well because of the way that the rim is sloped. And a shot glass is 1 or 2 ounces, so it's perfect. And you put some milk in there, and then you hold it up to baby's lips, and you put the milk just touching baby's lips and let them lap it up. And it's adorable when they do.
Yeah, I know.
The key is to not pour it in because then they'll want to hit the brakes. That's too much. So you let them control the rate, and they do quite well. If you do it like that, it can get a little messy, especially like we talked about the hands. Can sometimes knock it. So just have a bib on them and enjoy the cuteness and encourage your partner to cup feed because really they don't need a bottle. So if they won't take it, that's fine. They don't need one. You can feed through other methods. You can also feed with a spoon, same kind of idea. You hold the milk to baby's lips. It's just a little slower, 1 spoonful at a time. But if cup feeding's a little too messy, then yeah, there are lots of different options to bottle feeding.
Nice, great suggestions. All right, so this is our last question of the day, unless anybody, well, yeah, not live, so.
Yeah.
Last question. I think my baby has a flat spot on the back of her head. She is 5 weeks old and she can turn her head both ways, but she prefers to look to the left. When we're feeding, she has a harder time feeding from my left breast. Will the flat spot get better on its own? How do I get her to feed the same on both sides?
So I think this question might have been submitted because I'm a physiotherapist as well, because it sounds like, yeah, that flat head syndrome or plagiocephaly, it might be called. There's a couple different names for it. And the head turning preference might be a mild torticollis. So this is very much in the physio realm. So she's 5 weeks old and she can turn her head both ways, but she has a preference to look one way. So it's great that she can turn both ways. That's really good. And we want to encourage that, through tummy time and play. It is impacting breastfeeding as well, and so that's important to note. So will the flat spot get better on its own? Oftentimes it will get better, but that really depends on how much it's exposed to, a hard surface being on it all the time. So she prefers to look to the left, so that flat spot would probably be on the back left side of her head. So if she's lying on her back a lot, in her crib or bassinet, and then in the stroller, and then in the car seat, and then on the play mat, and then in the swing, and the back of her head is just always touching something. Those bones are so soft that they can really mold quite easily. Now it's important to know that that flat spot is really a cosmetic issue. It doesn't impact brain development, but later down the road, it can make it difficult to have well-fitting sports helmets and glasses and that kind of thing. So if we can fix it, then great. The head turning preference, though, we definitely do want to get on as early as possible, because the research does say that they have better outcomes if we help them early on. And so I'd recommend connecting with a physiotherapist who can then assess her range of motion and her strength on either side of her neck and her function, and then go from there. But in general, it's pretty straightforward in terms of the physiotherapist will do a quick assessment, probably virtually through video right now, not in clinic. And then if you can have a physiotherapist who can assess the feeding as well and give you some tips on how to adjust the position for your baby's range of motion and strength on either side of their neck, then that would be helpful. And then babies are pretty adaptable. I mean, they change before your eyes, and they get that range of motion and they get that strength pretty quickly. It's amazing compared to working with adults. So the physiotherapist will probably give you some exercises to do. Really encourage tummy time. You want to do lots and lots of tummy time, partly to get the pressure off of that side of the head, and also to develop the neck strength and that symmetry. And then at 5 weeks old, you can probably turn her head during tummy time and encourage her to look right. And then in a few weeks, when she's starting to follow objects, you can put some jingly keys on her right, or you can get down on the mat on her right side and encourage her to look to that side. And lots of little things like that you can do. Definitely connecting with a physiotherapist would be a good idea.
Great. Yeah, I think all of mine probably had a preference. I'm sure it's probably pretty common.
Very common. Very common. Yeah.
Well, I think we're probably going to wrap this up now. Thanks everybody for joining us after the recording. You can find Birth Unlimited online. We have a website. I don't have it pulled up right now, but I'm sure a quick Google search for Birth Unlimited will pull that up. And we're on Facebook and Instagram. You can also use our website to find previous issues of Birthing Magazine.
If you'd like to talk further with me, I'm always available by phone or email. My phone number is 403-237-0211. And the email is mercedes@vidahealth.ca. And if you're in Alberta, Northwest Territories, or Nunavut, and you want to make an appointment with any one of us for physiotherapy, for lactation, for mental health, you can email me, mercedes@vidahealth.ca, and I'll get you connected with the right person.
Great. Well, thanks everybody. The video recording will be up on Facebook just as soon as we can. And all right. Well, thanks everybody.
Thanks everyone. Bye.
Bye.